Welcome to NUR 300, Week 4, Part 3. Thank you for your participation in Week 4, and we will wrap up Thank you for your participation in Week 3, and we will wrap up Week 4 in this section. I do apologize for 3 pieces. So Part 1, Part 2, and Part 3 tonight. So where we left off, social media, warning, warning, warning. The professional value of social media comes with a very serious caveat. The patient retains his or her right to confidentiality and privacy in every medium. Not only must nurses be very careful in not using a patient's name, but they must be thorough in avoiding any other type of identifying information. Such information may include geographic, facility name, room number, or the patient's age, gender, and diagnoses combined with any of these data. Nurses, like most of our society, are connected in their personal lives to multiple online social media sources such as Facebook, Twitter, and various blogs. Excuse me. Sitting at home along with a computer may create a sense of privacy, but nothing could be further from the truth. Posting intended for immediate family or friends and protected by the site's privacy policy are not infallible. Any posted in online exists forever on a server somewhere, even if it is deleted from the site. This information is forever discoverable in a court of law and can be used in a trial. Friends might find your story so touching or endearing that they repost to their friends, and the story takes on a life of its own with no available control or dissemination on your part. A good example of unintended outcome of a moment's misjudgment is presented in NCSBN's social media guidelines. A nursing student took a picture of a minor child with permission and posted it to her Facebook page with a comment about his bravery during his illness and how much she loved her chosen profession. Although she did not identify the patient by name, the patient's room number was visible in the photo. The patient and his hospital were identified by others viewing the post. Ultimately, the hospital was charged with a violation of HIPAA. The nursing program was barred from the clinical site and the student was expelled. Understanding and managing conflict. A major goal of communication is to establish understanding and cooperation with others. However, much of our social environment is characterized by interactions that involve conflict, misunderstanding, and a failure to communicate. When more than one person is involved in the interaction, a potential exists for disagreement and misunderstanding. When the interaction becomes stressful, taking on a competitive, hostile, or oppositional nature, it can be classified as conflict. That's from Mayer 2000. Conflicts stemming from differences in goals or desires are not good or bad. The two fundamental bases for conflicts are information. One person has information and the other does not have, or two individuals have different sets of information and perception, people seeing things differently on the basis of their unique belief system. Despite the discomfort, disparate points of view can result in constructive behavior and positive outcomes. Conflict, like stress, can have beneficial and detrimental consequences to an individual. Some of the benefits that may arise from conflict include recognize talents and innovative abilities, identify an outlet for expression or aggressive urges, introduce innovation and change, diagnose problems or areas of concern, establish unity, also from Mayer 2000. Harmful consequences or prolonged conflict include a negative effect on emotional and physical well-being, an emphasis as on one's own welfare that the group, a diversion of time and energy from important goals, financial and emotional costs, and personal fatigue. Most of us experience abundant opportunities for conflict, which may be related to the fact that we bring to our relationships an accumulation of attitudes, beliefs, opinions, and habits. Thus, conflict is normal and is not necessarily something to avoid. Although uncomfortable, conflict signals the presence of diverse points of view, which can spark creativity, nourish growth, and strengthen relationships. Maintaining an environment supported of professional, clear, and sensitive communication enables individuals to fight more productively with less hurt and with a greater chance of resolving differences and disagreements. In today's healthcare environment, where high stress levels are all too common and patient safety, quality of care, and financial constraints are everyday concerns, nurses play a vital role in promoting a productive work environment in which trust and rapport among the healthcare team is common and all working towards the same goal: delivery of safe, timely, efficient, effective, and patient-centered healthcare. Professional, clear, and sensitive communication provides the foundation for creating such supportive, effective care environments. The first step towards developing a professional communication style is understanding the many complex and varied factors that influence the communication process, such as gender, cultural, generational, and interdisciplinary differences, each of which presents many challenges for the nurse who must strive to understand and to be understood. The second step is adopting positive communication techniques, which include developing trust, using I messages, establishing eye contact, keeping promises, feeling empathy, using open-ended communication style, clarifying information, and being aware of body language. This third step for each nurse is to reflect on his or her use of negative communication techniques such as blocking, false assurances, conflicting messages, logical fallacies, and cognitive distortions that may interfere with effective relationships with patients and coworkers. Recognizing, then avoiding the use of negative communication techniques is essential if the nurse is to move forward toward a professional communication style. The next step in developing a professional communication style is learning to address and resolve conflict in a positive way. Demonstrating a professional, clear, and sensitive communication style is an essential component to the professional nursing skill set. As the foundation for effective, supportive work environments and excellent patient care, professional communication must be one goal every nurse strives to achieve. Effective delegation and supervision. The safe and effective delivery of patient care is the fundamental goal of every healthcare organization. To accomplish this goal effectively, teams of diverse professionals and assistants are used to deliver care. Because the RN is most often responsible for coordinating care provided by various team members, he or she must clearly understand and be able to effectively use the management processes of delegation and supervision to ensure high quality, safe patient care. This lesson highlights issues that influences staffing patterns and the delegation and supervision processes. The lesson also discusses the RN's role and responsibility in delegating to and supervising staff members, including unlicensed personnel's UAP and LPN's LVNs, and provides useful guidelines for establishing a effective delegation and supervision practice. That concludes our week 4 lecture, NUR 300. I will see you guys in week 5.